I'm so depressed because of what you said. I was depressed thinking about it. I got depressed because I got less marks yesterday. These are a few phrases I've heard over some time now. Nowadays, the word depressed has become a substitute for sadness, grief, or loss that when people talk about clinical depression, they are misunderstood to be sad. This is extremely important to understand because if we are going to treat a person suffering from clinical depression as a person feeling less than clinical depression, which is known to be very severe, that it could lead to suicide, then the chances that he might be thinking of seeking help would be very low, and unknowingly we might have become a reason for a person to not take clinical depression seriously. So let's use the word wisely. So, how do you differentiate depression from sadness? Now, depressive disorders are a few. And today, we are going to be talking about major depressive disorder, which we commonly talk of as depression. If a person is feeling either a depressed mood like sadness, emptiness, hopelessness, alone, or along with loss of interest and pleasure in what he used to like before for 2 weeks continuously. I repeat, for 2 weeks continuously every single day, with any of the other symptoms like weight loss or lack of sleep or sleeping too much, loss of energy, feelings of worthlessness, inappropriate guilt nearly every single day, indecisiveness, and lack of concentration, then the person might be suffering from clinical depression. Now, remember, these are not all the symptoms, but some major ones based on DSM-5, and depending on the condition, the clinical psychologist or the psychiatrist will diagnose the severity. Research shows that the major causes for depression are upsetting or stressful life events like grief, loss of job, money, divorce, illness, or a sedentary lifestyle, abuse, some personality traits like low self-esteem, being overly self-critical, loneliness, and also sometimes depression runs in the genes. We also know that giving birth could lead a woman to be depressed, which we commonly call as postpartum depression. Now, though depression is commonly spoken amongst adults, we must be aware that children could get depressed too. Some therapies that have proven to work for depression are behavior therapy, cognitive behavior therapy, dialectical behavior therapy, and psychodynamic therapy. If we notice ourselves being sad, we could try our level best to uplift our mood by using the tips discussed in Fecare's video before. However, if this is not helping and you see yourself being sad for more than 2 weeks continuously, then seeking professional help from a psychological service like Fecare is important. Accepting that you have depression and seeking out help could be the bravest thing someone could ever do. So let's normalize going to therapy and share this video with someone if you think they are in need of this. Congratulations! You have just invested 3.5 minutes of your time for your mind. This is Aisha Badruddin signing off. Stay tuned and take care.